Good afternoon, everyone, and welcome to today's briefing, Investing in the Next Generation, Sustaining WIC's Enhanced Fruit and Vegetable Benefit. My name is Brian Dittmeyer, and I'm the Senior Director of Public Policy at the National WIC Association, a nonprofit membership organization that represents WIC providers in all 50 states. The Special Supplemental Nutrition Program for Women, Infants, and Children, or WIC, has for nearly 50 years delivered improved health outcomes for pregnant and postpartum women, infants, and children up to age 5 through a combination of a monthly food benefit and quality nutrition and breastfeeding services. WIC's work has continued undeterred through the COVID-19 pandemic to continue to support families at this critical life stage. Since April 2021, WIC provider agencies in all 50 states, the District of Columbia, 5 territories, and 33 Indian tribal organizations have partnered with retail grocers and farmers and farm stands to deliver enhanced benefits that provide additional access to healthy and nutritious fruits, and most specifically fruits and vegetables. This WIC benefit bump, added value for fruits and vegetables, has significantly increased access to nutritious foods during a time when families are increasingly struggle to afford enough food for the table and to reach those high-cost nutritious foods that deliver healthier outcomes for young children. We have a stellar panel lined up today that will walk through the specifics of the implementation of this increased benefit level for WIC, as well as the impacts for retail grocers, for child health outcomes, and for the WIC program in the long term. Before we get started, though, we are excited to have introductory remarks from Congressman Brian Fitzpatrick of Pennsylvania, who for his 5 years in Congress has been a consistent supporter of WIC funding and looking at broader solutions to the public health crises that face this country, including chronic diet-related conditions and the nation's healthcare expenditures. Through his work with the Bipartisan Problem Solvers Caucus, Congressman Fitzpatrick has identified WIC as an effective intervention that is worthy of federal investment to support child nutrition outcomes and ensure that every child has access to a healthy start. We now welcome Congressman Fitzpatrick.
Thank you for the introduction, Brian. Hello, everyone. Brian Fitzpatrick here from Pennsylvania's 1st Congressional District. It's great to join you virtually for the Alliance to End Hunger and National WIC Association's Hill Briefing. Since 1974, the Special Supplemental Nutrition Program for Women, Infants, and Children has provided monthly benefits to purchase healthier foods and deliver nutrition services in community-based clinics across our nation. Over the past year, WIC has served 6.3 million women, infants, and children, including approximately 160,000 Pennsylvanians. I have always been an advocate of WIC and supportive of the funding for this essential program that provides supplemental foods, healthcare referrals, and nutrition education to our nation's underserved families. Assuring access to proper nutrition is one of the most cost-efficient ways to grow a healthier next generation of Americans and control long-term healthcare expenditures. Since the onset of the COVID-19 pandemic, childhood hunger and food insecurity have risen dramatically in the United States. And now, with food prices on the rise due to supply chain issues and labor shortages, families are struggling to purchase healthy, nutritionally dense, higher cost foods. There couldn't be a more crucial time to ensure that our families and children have access to the WIC program and the resources that they need. WIC families deserve our continued support, and I will continue my work here in Congress to improve the health of nutritionally at-risk citizens. Their well-being is a top priority of mine. So thank you for all the work you do, and God bless.
Thank you so much, Congressman Fitzpatrick. Congressman Fitzpatrick joins a number of champions on both sides of the aisle who have been supportive of WIC and taking a pretty firm and strong look at how WIC can be leveraged during the COVID-19 pandemic to further support the nutrition needs of parents with young children. I'm now excited to introduce our dynamic panel today that will highlight the role that WIC has played during COVID-19 to enhance access to fruits and vegetables and to ensure healthier outcomes for young children. We will start first with our partner in this briefing today, the Executive Director of the Alliance to End Hunger, Eric Mitchell, who has led the Alliance during COVID-19 and has some exciting information about a nationwide poll that demonstrates information about how voters and citizens in all across the United States are perceiving WIC's role in supporting healthy outcomes. We will then hear from Leslie Hibbs, who is a WIC director with the City of Dallas WIC program in Texas, who will walk through the specifics of how the enhanced value has been implemented at the local level and what WIC providers are seeing as far as the effects of increased access to fruits and vegetables. We'll then hear from Wade Payne, who's the Director of Retail Operations with Mitchell Grocery in Alabama, who will, from the retailer perspective, provide insight into what we're seeing in retail grocery stores as far as changing patterns of WIC shoppers. Finally, we'll hear from Donna Forrester with ProMedica's EBID Children's Hospital in Toledo, Ohio, who will provide perspective on the health outcomes that WIC is seeking to deliver for child development and for long-term investment in the nation's future. These panelists all represent from geographically diverse locations a consistent perspective that WIC's enhanced cash value benefit has delivered improved outcomes for children, their long-term health, and the economic security of families during COVID-19. Eric, I'll now pass it over to you to get us started.
Thank you, Brian, and I want to welcome everyone for joining us on this very important briefing. The Alliance to End Hunger and the National WIC Association has partnered together to lead a nationwide poll on voter support for WIC. Back in 2012, the National WIC Association did a similar poll, and we were very pleased to see that the voter support for WIC has not only maintained over the last 10 years, but has actually grown. In partnership with McLaughlin and Associates, ALG Research conducted an online nationwide survey of likely 2022 voters in both English and Spanish. The survey consisted of over 2,000 interviews and were conducted in September 2021. Next slide. The WIC program is incredibly popular and enjoys significant support. The majority of voters rate WIC favorably, and about 8 in 10 voters indicate support for the program after hearing a short description of how this program works. Support for the WIC program transcends demographics, and the number of voters who strongly support WIC outpaces the total opposition. Overall, more than 3/4 of the voters nationwide agreed that COVID-19 has made it even more important to support WIC. Next slide. Voters view WIC as being important for women and children, making a difference and helping to break the poverty cycle. A majority of voters nationwide see WIC as a good investment and disagree that it's too costly. Voters are most compelled to support WIC because the program assures that pregnant women and young children not only have access to healthy foods, but also have access to information about healthy living, preventative health care and vaccines, and resources to ask questions. Which brings me to the healthcare costs for everyone. By having fewer sick, this brings down the total healthcare costs for everyone by having fewer sick and chronically ill people who can burden our system and cost to taxpayers. Next slide. As you can see, there is overall bipartisan support for key WIC reforms. When we talk about reforms that are important to making this program more accessible, there's strong majority of voters, including Democrats, Independents, and Republicans, favor increased investment in WIC and policy reforms that enhance the program's reach. In terms of WIC support in general, increasing funding to provide more healthy food is the most compelling message for voters. Voters find value in improving health. A majority of voters across the board feel the best reason to support the increased funding for WIC program is because it helps children live healthier lives. There's a lot more information and data that we have regarding this poll, and feel free to go to either National WIC Association's website or the Alliance to End Hunger's website to learn more. From here, I'm going to pass it over to Leslie Hibbs, who's the WIC Director for the City of Dallas WIC Program. Leslie?
Good afternoon. Thank you, Eric. Again, my name is Leslie Hibbs. I am excited to be here this afternoon to visit with you guys about the Texas implementation of the WIC benefit bump. Again, I'm Leslie Hibbs, and I am the City of Dallas WIC Director. We serve monthly about 64,000 WIC participants in Dallas County at 16 sites. And it is a very rural, it's a very urban atmosphere here. And previously to being the City of Dallas WIC Director, I was a WIC Director in a rural central area of Texas that served 7 counties through 8 sites. And had a participation of about 8,000 per month. So I have seen delivery of WIC services in very rural, sparsely populated areas of Texas. And now I serve WIC in a very urban, densely populated demographic. And so, but I'm really, really excited to be here today to talk about the enhanced WIC benefits, that cash value benefit for WIC participants that we have been experiencing over the last few months. So next slide, please. So first, I want to start with giving you a little bit of a historical background of the cash value benefit and when it was implemented in WIC. So in 2009, when the most recent USDA food package revision was done, that is when the introduction of the fruits and vegetables benefit came into the WIC package for the first time. The USDA set the cash value benefit levels at $9 for children participants and $11 for many other of the women expecting and breastfeeding moms that are on the WIC program. So the 2 levels of cash value benefit that was enacted in 2009 was $9 and $11 per participant per month as a cash value benefit for selecting only fruits and vegetables in the supermarkets. So while helpful, the cash value benefit amounts were not enough to ensure consistent access to fruits and vegetables during the course of the month for the families. But what it did do was it was proven effective in increasing access to healthy foods in low-income neighborhoods and increasing consumption of fruits and vegetables among children. This cash value benefit for fruits and vegetables in the WIC program has been associated with aligning obesity rates of WIC enrolled children with the national average, closing that disparity of obesity rates that was differing between WIC participants and non-WIC participants. Then in 2017, the National Academies of Science recommended increasing the WIC fruit and vegetable benefit to support improved child health outcomes. So this expert recommendation was based on suggested diet patterns, including the Dietary Guidelines for Americans, but this recommendation is based on science. So the reason why we are here is to really grow healthier children and improve health outcomes. It's very simply put that an increased access to fruits and vegetables leads to healthier kids. The inclusion of the fruits and vegetables is a science-based recommendation that leads to healthier kids and is one of the most effective ways of doing that. Next slide, please. So in May of 2020, the WIC benefit flexibility during COVID-19 Act was introduced. This bipartisan bill was led by Representative Kim Schreier and the late Ron Wright. And they sought to increase the WIC cash value benefit to provide aid to families and create new markets for fruit and vegetable producers. This bipartisan bill was then folded into the American Rescue Plan Act in March of this year. And that benefit of the Congress bumped the WIC's cash value benefit to $35 per month per participant over a 4-month period. That was in our state, we did June through September. Yeah, and that benefit expired in September of this year. To go from $9 a month to $35 a month in fruits and vegetables, cash value benefit in WIC is tremendous for families. That triples the amount that they have to access and select and choose and consume fresh produce. We saw a lot of great things happen that I'll go into a little bit further while participants were receiving a $35 fruit and vegetable benefit every month over the summer months. So then in December of, okay, I'm sorry, let me go back. Let me get back on track with my timeline here. So in September of 2021, a continuing resolution extended the WIC benefit bump. So we were set to, the increase in fruits and vegetables was set to go back to $9 and $11 at the beginning, the first day of October. But at the very end of September, we were very grateful that a continuing resolution extended this increased enhanced benefit, and it aligned the WIC cash value benefits with scientific recommendations for 50% of the recommended fruits and vegetables intake, amounting to $24 for children and $43 per month for pregnant postpartum, and $47 a month for breastfeeding participants through December 31st, 2021. This WIC benefit bump is set to expire unless Congress acts. And so that again is why we're here today. So this benefit that we're currently in, the continuing resolution that's issuing $24 per month for these 3 months for children, $43 a month for fruits and vegetables for pregnant and postpartum women, and $47 a month for breastfeeding participants, again, is set to expire on December the 31st of 2021. And we are asking for sustaining an increased bump much longer. What else do I want to say about that before going to the next slide? I think that is about it. So next slide, please. So one thing that I need to mention, that I need to make note of, is that through the COVID waivers authorized by the Family First Coronavirus Response Act, most states can remotely adjust the program benefits changes and automatically upload benefits to the participant's electronic benefit transaction card, or EBT card. However, 9 states have offline systems that require EBT cards to be adjusted manually at locations. And these are the 9 states that have offline benefit issuance systems. And so one thing to note is that creating the enhanced benefit onto the card for participants to use in grocery stores is a tremendous amount of work. Every system has to go in individually. Every state has to go in individually and make the modifications and adjustments to the benefits that they issue to the participants. But in offline states, we issue directly onto the card, the chip that's laid onto the card. And so we can't make adjustments just electronically over, each month. We have to get each participant to come back in with their benefits and have them modified. So in So adjusting for new benefit levels, again, is an extraordinary amount of work at the local level, even in the online states. It's not just a flip of the switch, but it must be individually programmed, which is an immense amount of work. But this is really what we are here to do, and we are happy to do it. In the first one, when the American Families Rescue Act passed in March-ish, we had from April, May, June till June to make those adjustments and modify those cards. But this newer one with the continued resolution, it was passed the last day of September to go into effect the first day of October. And we are still getting our participants to come back to get that enhanced benefit loaded onto their card. It's a little bit more difficult of a process without proper lead time in the beginning. So that's another one of the things that I'd really like to express to you guys in your thoughts for making short-term solutions and then longer term solutions as well, because when we have a longer term solution, it'll make it a lot easier for all of us to get those benefits out to the participants so that they can be redeemed with enough time to make it most impactful, which is really what we're trying to make sure happens. So again, adjusting, this is what we do. This is what we're here for. We're happy to make the adjustments no matter what, because we know the difference it means for our participants. Next slide. In addition to loading the cards and reloading the cards for offline states, the WIC staff must educate the participant about the changes in their benefit levels and encourage full redemption. And I'll talk a little bit more about that in a minute too, but basically we had to educate all of our state, all of the other directors in the state that this benefit bump is coming. And we educated our participants that for a period of time, they're getting increased fruit and vegetable access. We provided them ideas for how to increase their consumption of fruits and vegetables, how to get their children involved in selecting those fruits and vegetables, and then also about budgeting and spending their resources to improve their children's nutrition and health. So with longer term clarity, including an extension of the WIC benefit bump through September 2022, will support state and local agencies to more effectively distribute the enhanced benefit. Again, we did a really, really, really good job modifying or educating the participants of their increased benefits over the summer months. And then we are still working at doing a really good job, but we are afraid that some participants are falling through the cracks because we didn't have the front end time before this benefit hit. And we needed to get all of our participants to come back for the modification of their enhanced benefits. So with more time for delivering the enhanced benefit or for a longer time frame for receiving the benefit, this will help, again, effectively distribute the enhanced benefit and reduce additional clinic visits. It'll provide more consistency to WIC families as they plan their grocery budgets and shop for nutritious foods. So again, we can ensure that this goes far more smoothly in the future if you will sustain the cash value benefit increased bump and then sustain it ongoing. So for offline states, the benefits are issued months in advance. And again, when the last adjustment was made, we had plenty of time to get the participants back in and get their cards modified before they, the time frame passed. And at this point in time, with the continued resolution increase, we love the amounts. We know they're based in science. We're able to explain that to the participants, but that's once they've come back in to get that that benefit loaded. Let's see. So the longer term clarity and more time on the front end to program these changes, the better it will be for us as WIC providers to better deliver this benefit, and will ensure that we have the resources, it will ensure that the participants have the resources they need to purchase fruits and vegetables. So I'm ready to go to my next slide, please. So here in Texas, this WIC benefit bump that we saw over the summer months, in September of 2021, 86.12% of our participants redeemed their WIC cash value benefits for fruits and vegetables. So that translates to, again, in September of this year, the average total dollar amount redeemed out of the $35 per participant was $32.86. Texas WIC offers fresh frozen, and canned fruits and vegetables. Most of our participants do redeem for fresh fruits and vegetables. Next slide, please. So this chart shows you kind of from last year and this year, what the redemption of the benefits for cash value benefits for fruits and vegetables were. So you can see that it stayed very steady in May, and in June, when the rescue plan was put into place and the enhanced benefits at $35 per person were loaded onto the participant benefit cards, it almost tripled the amount of fresh produce of fruits and vegetables available to our participants in their homes over June, July, and August. And as you can see, by September, it did completely triple the redemption amounts we had seen the year before, meaning that many children in our state had triple the amount of fruits and vegetables in their home for them to choose to eat. This has many layers of benefits for creating a healthier generation and improving the health outcome for children in many demographic groups, but especially the ones that participate in the WIC program. I think that is covered that slide pretty well, so I will go on to the next slide, please. So again, I would like to talk about the impacts of the WIC benefit bump here in my community in Dallas. And so the increases purchases, nearly tripling the produce at retail grocers here in our area. It increased the consumption of fruits and vegetables, supporting the nutrition of families, and participants are purchasing and consuming an increased variety of fruits and vegetables. And on this slide, we have one of our actual clients that was here over the summer, and we were kind of surveying participants as they were leaving after their appointment. How do you feel about the increase in the cash value benefit for fruits and vegetables on the WIC program over these summer months? And this mom and her two kiddos said, wow, getting this extra money for veggies and fruits is amazing, because getting $70 per month rather than $18 per month for produce has been a big help for us and makes a big difference for my kids. They love to eat veggies and fruits. Without WIC, this would have never been possible. Please let this extra benefit continue. And so I too want to urge everyone to be part of sustaining the WIC bump enhanced fruit and vegetable cash value benefit. Increasing the amount of healthy foods, specifically fruits and vegetables, in the homes of families who receive and redeem WIC benefits. Having this resource that affords participants increased opportunity to choose and eat nutritious foods may reduce gaps in health disparities for certain demographic groups. The fruit and veggie benefits for WIC participants, increasing and sustaining the fruit and vegetable benefit for WIC participants is a step towards addressing health inequities and not just hunger. We know through research that providing access to food is very important. Providing access to healthy foods is critical. It's not just access to food. Access to just food is making some groups less healthy. It's not having the intended effect of helping people have better health outcomes. Increasing nutritional foods and giving people the ability to access, to choose, and to consume fruits and vegetables really is about health equity and not just hunger. So I want to thank you for this opportunity, and I would now like to turn it over to Mr. Payne for the next presentation.
Leslie, hi, and I would like to thank everyone for their time today and coming here to listen to us, what we have to say about WIC. I'm Wade Payne. I'm with Mitchell Grocery in Alabama. We operate we're a wholesaler. We service a lot of stores, but we do operate 32 stores in the state. As far south as Livingston, as far north as Muscle Shoals and Florence. We have a wide variety of stores, all of which participate in the WIC program, which is a very effective program for us. Gives an opportunity to help a consumer that really needs the help. For us, the increase in the value, obviously it moves more product in the produce section, which we're grateful for. Our job is to educate our staff, our produce clerks, our cashiers, in order to be able to help the consumer to realize what is available, what they can purchase with the increased cash value. We have seen a steady increase in fruits and vegetables, but we've also seen them take advantage of some of the value-added stuff, some of the cut fruits and the cut vegetables. You got a lot of busy moms out there that are a lot of them working, going back to work after having children. So having that quick and easy, healthy snack to leave there for their children to have, very important, I would think. And we are seeing them take advantage of that. And by the increased amount in the cash value, they're able to afford to be able to do that and take advantage of that. They are busy. We're talking about changing habits, talking about children eating healthier. So it takes time to change habits. And so I would encourage you to consider extending this benefit a longer term in order to support that change in habits. We talk about it all the time. We need to get kids to eat healthier. So the longer we can extend this benefit and keep that healthy food going across those tables and into those homes, I think the better chance we have to, as Leslie said before, create a healthier generation. There again, like I said, our commitment is to help educate, help the consumer as they come into our stores know what they can buy, know what the benefits are, take full advantage of the benefit. We like to talk to our cashiers about, they have a little benefit left on. We can see that especially under the EWIC program we have here in Alabama. So we encourage them to use it up every month and take advantage of it. So that's our role. Talking to our cashiers and our clerks and our produce clerks, they definitely spend a lot of time talking to those consumers and helping those consumers move forward. So I think Leslie did a good job of explaining the details of the program. Everybody here is an expert. I'm just telling you what happens out there in the store. But we definitely see the benefit. And again, I appreciate your time today. And with that, I'm going to turn it over to Donna and let her follow up.
Hi, my name is Donna Forrester. I am the WIC Project Director for Toledo Hospital, Toledo Children's Evide Hospital. And I have been asked to basically talk about the advantages, the health advantages of the additional fruit and vegetables. And as I've been listening to the panelists, one of the things that I'm hearing is, of course, we are in favor of extending the benefits for fruit and vegetables. But I want everyone to know it's not just that somebody gets extra money on their WIC card. A lot of other things go into it. And I did write something that I would like to read because I do like what it says. I think it covers what we're basically trying to get at as well. And I just said WIC offers nutrition education in the form of recipes, diet counseling, and shopping tips. This conversation between the parent/caregiver and the WIC health professionals helps to provide value for the additional fruit and vegetable dollars. It motivates our patients and caregivers to try something new and to expand their existing family food boundaries. This is really important and it's huge. It's what makes the additional money for fruit and vegetables the most important. The parents are buying into it. When the parent caregiver sees values in purchasing the additional fruit and vegetables, and possibly offering this type of food as a snack, this is where we see childhood obesity decline and overall health improve. WIC does reduce healthcare spending. It helps to improve the health and well-being of the population that it serves by offering nutrition education and providing healthy food choices. Since we recommend half of the plate is filled with fruit and vegetables, it just makes sense to extend the WIC cash value benefit. Better food choices lead to better health outcomes and reduced healthcare spending. And that primarily is where we're at in our office. We're not just saying, okay, you have an additional amount of fruit and vegetables, but hey, have you tried this? The holidays are coming up. Have you tried baked sweet potatoes? And, have you tried a salad? Or what about fruit or veggie kebabs? The parents really seem to like the idea of getting creative when serving food, and they really like the fruit and veggie kebab idea. So you can take some fruit and vegetables that they do like, maybe add a new one to it, put it on a toothpick for age-appropriate kids, and it is something that kids do enjoy. And again, it expands the food boundaries for the whole family. So that is basically what I wanted to say about it. And we like the new food package. It does provide healthy foods, it provides substantial foods, and that can be part of a really healthy meal as well. Thank you. And I guess I will turn this over to Brian.
Thank you so much. Now, if I can invite the whole panel to come back on video, we can go into Q&A. Excellent. If you have a question, please use either the Q&A tab or the chat to ask your question, and we will make sure that they're asked to the panel. So the first piece, and I'll direct this to Leslie and Donna as the administrators of WIC programs. So when someone comes in to modify their card, do they get retroactive benefits for the months that they missed?
They do not. It would just be the month that we're currently in. And that is with all WIC cards, if they need to use the benefits by the end of the month, because once the next month comes around, they've basically lost what they haven't used.
That's right. They do not carry forward. If we issued the regular amount, the 9 or the 11 that had gone back to the default, they are able to use that $9 or $11, but to get the increase, they need to come back and we load the difference. So they can even go ahead and spend in the current month the $9 or $11, but they do need to come back for us to put the additional amount on there. And we can modify for the future months, but we definitely cannot go back. Like she said, nothing rolls forward.
Okay, another question, and Wade, if you're able to weigh in on this one as well, that would be helpful. So what forms of fruits and vegetables are allowed in your states?
Well, as I said before, we're in Alabama, they were allowed to use the fresh cut product, fresh foods and vegetables cut, things like, and a lot of families don't have the ability to cut up a pineapple and all. So, but it's pretty well most fruits and vegetables we see. The basics is what we see the participants using here in the state.
And I'll add that I've heard our participants are, with the increased amount, like he had mentioned in his presentation, able to choose things that they don't always choose. So the children, I've heard people mention buying selecting cut up pineapple, whereas normally they wouldn't choose pineapple because it's very expensive and could potentially take the whole month's benefit for, a container of cut up pineapple in our area. And like Donna had mentioned, around the holidays, we were talking to families about trying pomegranates, about trying just different fruits and vegetables, or going more frequently to the store to select fresh produce and allowing their children to try new things and find that they like it. And that's been a really neat experience with the increased value that our children are able to go to the store and pick out things that the parents were generally, making selections that were affordable, the less expensive fruits and vegetables, really sticking with the red delicious apples and the inexpensive bananas and things like that are typical. And I myself even make those kind of choices at the grocery store. I have to kind of accommodate for budget, and with more funds specifically allowed for fruits and vegetables, it really does expand the choices, which expands the nutrients that they get as well. When they get a lot of variety, they get a variety of the nutrients in the produce as well. So
The other benefit of having the cash voucher all month is they can come back, all month, where some of the other WIC stuff, they have to get it all at once. This, with the cash voucher, they can spread it out with fresh product. You don't need to buy it all the first month. You need it later in the month, so it's still fresh and healthy.
And then just to really clarify here as well, so is it just for fresh fruits and vegetables?
no, it includes frozen and canned. They just can't have any other additives. So it can't be sauced. It can't have any kind of sauce or dip, but it could be fresh cut there in the grocery store. It could be frozen with no sauces. It could be fresh selected out of the produce, whole fresh fruit, cut fruit with nothing added, frozen fruit, canned fruit, and vegetables. It just can't have other ingredients added that are not straight fruit and vegetable.
Okay, I'll throw this one first to Leslie and then to Wade. Should the benefit be continued after December? And if it wasn't, what would the impacts be?
Well, for me, the impact would be that our participants' cash value benefit for fruits and vegetable defaults to what it is right now in the food package, which is $9 or $11. So that is what happens if this does not get the support and some traction, some action made. Did that answer the question? Was there a second part to that question?
Do you want to speak about what the impacts of going back to 9 and 11 would mean for the program?
Well, that means that our participants have to, be very careful about what they select, and they will probably reduce the amount of fruits and vegetables that they would themselves also, purchase. But I think that Donna probably has good information on that also.
Let me just add right there, before the amount went up, we actually saw participants that sometimes just didn't take advantage of the cash that was on there at all. It was just so small. They might buy it one time, buy something, they spent $7 or $8 on it, they only got $2 or $3 left, it would go to waste. With the added value, it becomes more of a habit, and our people, our cashiers, our clerks can encourage them how to spend the whole thing, make sure they take full advantage of the money. So we see a much higher use of the percentage use than we saw at the old value as far as the cash value. That's what we see on our side.
I have one more thing to add. Sorry, go ahead.
I think that is a great point, Wade. If people are not used to using it, or if it's just you use it at the beginning of the month and then you have to figure out how to use it again the next month, that's a great point, that the increased value would have them getting fruit and vegetables throughout the entire month.
And so what we know from that data that we showed from Texas is that our participants redeem basically the same percentage of the benefit, regardless of the total amount. So our participants are redeeming around 86%, but somewhere between 75 to 86% every month, if it is $9, $11, or $35 per participant. So when you give them $9, they redeem 70 to 85% of $11. And when you give them 35%, our participants are redeeming 70 to 85% of $35, or the other enhancements. So say the $24 and the $47 and $48 benefits. So they adapt to the increased amount, and it does clearly increase the amount that they are bringing into their homes and having available for their children to have. They're redeeming that same level, and so they're going to redeem this 86 to 70% of $9 versus 35 or 47, whatever the enhanced value is.
Great, thank you. A few questions about kind of national WIC policy. So the first piece here is, what is the main ask here? And what is the vehicle to deliver this extension? Is it through appropriations or through child nutrition reauthorization? And to be very clear, right now the question is, will there be an anomaly on the continuing resolution? And Leslie was talking earlier about the anomaly that was included in September that extended for 3 months. And without an anomaly, we go back to 9 and 11 come January 1st. So that is the immediate question here, is whether an anomaly will be included in a continuing resolution that passes before January 1st. Another question about the type of support that states would need to bring an EBT system online as opposed to offline. And so Leslie and Donna, as Ohio is also an offline state, if you have anything to say about this and whether it would make sense to move from an offline to an online state.
Go ahead, Leslie.
Okay, well, I am a lowly deliverer of services. I am not at the state level for how to select and implement the statewide vehicle for administering the benefits. So I am not really in a place where I could, but I think that it would be helpful to go towards an online. I'm not really, I don't have the ability to, say whether or not that's, in the cards or in the future, but there are pros and cons to both of those systems in my understanding. And again, just to keep on topic, the focus of the question was, would it be beneficial for offline states to go online? And there would be benefit to that.
Mm-hmm. Mm-hmm.
Mm-hmm. Because there would be things done on the back end that can't be done on the back end here.
I think it would help for working parents if we could just load their card without them having to come in. Not to say that we don't ever want to see them come into our office, but sometimes it's hard with working parents, or if they have a lot of kids, or if the kids have health issues. It would be nice for that flexibility, but I do agree with Leslie. There are pros and cons to that.
And I think one point to underscore as well is that that is a substantial technology project. It is not a flip of the switch. You can't immediately change over a state system. And so as this expanded benefit was rolled out back in April, we had to develop solutions for offline EBT states. And both Leslie and Donna have been doing incredible work to get this extended benefit to folks in a place where the system was not built to do that automatically. Another question about rollover of benefits and whether, noting that SNAP benefits do roll over into the next month, is there any consideration for changing that for WIC? And I would note the difference between the two programs in that the WIC benefit is really a prescription for healthy foods, and really keeping a focus on making sure that nutrients are being delivered consistently month to month to participants. And so that is really how the program has been structured and where the difference in benefit allocation is coming from. There has been talk on Capitol Hill of limited rollover that would allow 1 month, but that is a proposal that would need to be considered in a child nutrition reauthorization context. And I don't know if any of our panelists want to weigh in on that particular question. Okay, and I think as we come to a close, I just want to offer one last opportunity for our panelists to weigh in on what is the most significant change that you've seen as a result of the CBB increase.
So I will wrap the last question into this comment in that the best benefit, other than we can see that the homes have 3 times the amount of fruits and vegetables in them from the summer months, is what Donna was talking about, having that additional opportunity to visit with the families and teach them how to increase the fruits and vegetable consumption in their children, and them getting involved and excited about it and having the opportunity to work with their kids on increasing fruits and vegetables, to being able to afford to go and select new things to try for their children to try. The kebab ideas when we're doing little cooking demonstrations and posting them on social media and getting families to join in. And so it's just the additional education that comes with that prescribed fruits and vegetables increase that we get to teach them. And we will get to uncover more things to teach them as this continues, and we can see the redemption values, and that we even need to teach them to not do 86%, to redeem the full 100% of whatever is allotted to them. But we've got some scientific behaviors to look at to teaching people to redeem the entire amount, right? But they are doing a great job at redeeming the 70 to 86% and taking those tips and finding new ideas on how to work it in and have just a happy, healthy addition in their home of involving the kids, making them part of the process, and having more flexibility, variety for getting those healthy nutrients incorporated. So I have been most grateful with the ability to educate and talk to families about really increasing those fruits and vegetable consumption, and then it being coupled with the ability to do that. So that's the part that I've been most happy and pleased with as a benefit.
I could just weigh in right there. I think it's a no-brainer that we increase the cash value benefits for as long as possible, and that's the critical issue right now. Some of the things you're talking about, the leftover money, things like that will all come under the WIC reauthorization, which has been needing to happen for a few years, and hopefully that'll get to coming on board in 2022, and we could move forward to that and get the whole program streamlined and much more efficient. Little things like, they've got 75 cents left over. Why can't it roll over? Those things would come in a correction with the WIC reauthorization. That's down the road, and I would encourage you to look at that. But right now, we need this benefit extended so we keep those habits going like they are.
I'd like to thank our panelists. Unless Donna, did you have any closing remarks?
I just think the most exciting thing basically is to see the parents want to try new things, like what Leslie was saying, pomegranates or pineapples or Brussels sprouts, or that's exciting to see that it's not just corn and green beans like it used to be, or potatoes. So I feel that just the latitude that people will have for quick ideas, quick snacks, using fruit and vegetables for snack ideas, or people that really like to cook and can get elaborate and buy some of those more expensive ingredients that they wouldn't. So that is my thought. I do think it's a good idea.
Excellent. Thank you to all of our panelists for sharing their perspectives from around the country. And as we're moving into this busy week, it's important for everyone here in DC to be thinking about the real life ramifications for the 4.7 million WIC participants that are receiving this benefit. going back to $9 and $11 will have significant consequences in the shopping habits and the dietary behaviors of our 4.7 million WIC participants if they lose out on this added benefit come January 1st. And so, we are available as a resource. All of the panelists have shared their information. We will make sure to send out additional materials and follow up, but we are a resource to all of you as we navigate a busy couple of weeks here to make sure that families are set for not just the holidays, but for the beginning of next calendar year as well. And really doubling down on the economic security, the long-term health outcomes, and the investment in the children that are participating in WIC that this benefit provides. So thank you for joining today's briefing. Look out for our follow-up materials, and we look forward to engaging with you in dialogue as we move forward in the next couple of weeks.
Thank you.